Canine Station. I'm going to talk to you about the rabies vaccination today. This vaccination is ideal for dogs and cats at least 3 months of age. What you're going to do is you're going to inject 1 milliliter dose subcutaneously. And some of the adverse reactions would be vomiting, facial swelling, fever, lethargy, circulatory shock, loss of consciousness, and even death. Rabies vaccination is actually a kill drug, and it works by causing your body to produce its own protection against the rabies virus. To keep your pet protected, you need to keep them up to date on their vaccinations. They come in 1 to 3 year doses, so you want to make sure that you keep your pet up to date, whether it is on that 1 or 3 year. If you suspect that your pet has been infected by rabies from another animal, you need to contact your vet, and they will need to quarantine your pet for 10 days. And this concludes a section of your rabies vaccinations.
Hi, my name is Caitlin Marizoff. I'm here to talk to you today about leptospirosis. Leptospirosis is ideal for canine patients. What it is a vaccine that helps protect from a bacterial disease that affects the kidneys and the liver. Leptospirosis is a zoonotic disease. It comes pre-dosed in vials that need to be reconstituted. It comes as a standalone, or it comes in the distemper combo. The adverse reactions of leptospirosis are anaphylaxis, pain, swelling, abscesses, redness, or irritation. If any of these occurs in your pets, you should contact a veterinarian immediately so we can get them treated on that. This vaccine is a modified live vaccine. It injects the bacteria into the subcutaneous part of the body, and it helps build up immunity. And it is injected into the left rear, just so we know if there's any reactions, which vaccine it was that we given at the time. Some of the tests to find out if a dog has a leptospirosis would be some blood work, urinalysis. Symptoms would be fever, sore muscles, stiffness, shivering, vomiting, no appetite, increased thirst, or diarrhea. After the first initial dose of the leptospirosis vaccine, it is highly recommended to follow up with a veterinarian after 2 weeks of the initial dose to give a booster vaccine, just to make sure that it is properly administered into the pet and that is taking full effect to help make sure that our pets are nice and healthy. If a pet is suspected to have the virus, you do want to make sure that it has been fully treated before vaccinating in the future, because it can cause an increased risk of sickness in that pet. That concludes the section of leptospirosis vaccine, and I hope I answered any of your questions you may have.
Hi, my name is Katie, and I'm going to be discussing the Borrelia burgdorferi injection. This injection is for the prevention of Lyme disease. It is recommended of healthy dogs 9 weeks of age and older. However, it is used for any animal with tick exposure. For the Lyme vaccination, you would aseptically inject 1 ml subcutaneously into healthy dogs. In rare cases, injection may cause lethargy, fever, and inflammatory or hypersensitivity types of reactions. If this occurs, you can treat with antihistamines. Okay, Borrelia burgdorferi is a recombetic drug similar to modified live, which releases pathogens into the bodily system to set up immunity to tick-borne disease. It is advised for primary vaccination. Revaccinate with a second 1 ml dose 2 to 3 weeks later. First-year duration of immunity has been demonstrated for this product. Revaccinate annually with a single 1 ml dose. And this concludes Borrelia burgdorferi injection information.
Hello, my name is Angela, and today I'll be speaking with you about distemper vaccine. Sometimes distemper vaccines are given by themselves, but majority of the time they're given with other vaccines. Today I was speaking with you about Novavax DHPPI. This is a live vaccine determined for canines only. This vaccine contains your distemper, your adenovirus 2, your parvovirus, and your parainfluenza virus. The contents of the 1 vial reconstituted vaccine should be injected subcutaneously and can be used also with your Novavax Lepto-2 or rabies. Avoid contamination of chemical substance such as disinfectants or sterilization on the skin prior to inoculation. If early vaccination is needed, first dose can be given at 6 weeks of age, only if the pup is not nursing. If pup is nursing when giving the vaccination, the mother's passive antibodies can interfere with the response of vaccination. A final dose at age 10 weeks or older is generally recommended. A single injection establishes an active immunity. The duration of the immunity is at least 3 years, with all the canine viruses except your parainfluenza virus, which should be given in a yearly vaccination. The vaccine is given to alter the immune system in a safe way to establish immunity to the virus. Please store responsibly. Do not freeze and protect from light. Extreme temperatures can and will reduce the potency of the vaccination. There is no need for distemper or other illnesses test if you keep up with your yearly vaccination. If you miss your yearly vaccination and see signs and symptoms of disease, please contact your veterinarian ASAP and get in for a test to determine what virus the animal has. Like all vaccines, reactions can occur. From bruising and raising at site of injection, signs and symptoms of the virus, anaphylactic shock being your worst. If you see any of these symptoms in your animals, please contact your local vet and remember to vaccinate your animals yearly. Thank you.